Hey, welcome back to the show. Children's Aid is helping people in poverty to succeed as well as thrive. They provide comprehensive support to youth and their families, targeting high needs neighborhoods. Now, the organization is doing more in the effort of working with the community to get more people vaccinated as well as having COVID testing. We're pleased to have joining with us right now the Vice President of Health and Wellness at Children's Aid, Rhonda Braxton. And Rhonda, I want to thank you for coming and joining us. And when we talk about children getting vaccinated, we know that it's been an uphill battle. How have things been looking on your end?
Well, thank you so much for having me. Yes, it has been a little bit of an uphill battle, but Children's Aid is very dedicated to the community and ensuring the health and wellness of the children and families that we serve. So we really, at the beginning of the pandemic, we took to heart the idea that we have to go out and provide accurate medical information to our clients and their families, and to do our best to provide the best services to the community.
And you're not just waiting for people to come through your doors. Obviously, you have some mechanisms that you're actually reaching people. You've got testing buses right in the borough of the Bronx. Talk to us about your buses and the work that it's doing there.
Sure. Well, we first started with health education. We wanted to make sure that everyone had medically accurate information. So we had webinars, we had flyers, other campaigns, and then we partnered with other community organizations even before we were able to provide vaccines at our sites. But testing was paramount to the success of the initiative. We partnered with the Health and Hospitals Corporation, the Test and Trace organization, to get testing mobile vans, buses at our sites, primarily in the Bronx. That's where we started because we wanted to address the higher risk needs of our community. We advertised those services, partnered, had the vans there 7 days a week on a weekly basis. And we're really proud to say that through that partnership, we were able to provide 7,000 tests altogether, 5,000 tests in the Bronx. And later, when the vaccine became available, we were also able to use those same resources for vaccination.
We know within the African American community and communities of color, there is a huge vaccine hesitancy. When it comes to testing, even that as well. Did you find that you were able to break down some walls, if you will, to be able to get people to become more receptive, given the fact that so many people still have some questions, even though we're making some progress, but still have a way to go?
Absolutely. Again, it was our goal to chip away, well, really first acknowledge the hesitancy and the reason behind it, acknowledge the background that communities of color have had negative experiences historically with the medical field, and just address that head on, have informational sessions, have trusted people of color and pediatricians who are known to be trusted resources in the community, to have one-on-one conversations, to educate first our staff and from the front desk on as to accurate information, how to speak to clients, again, webinars, one-on-one conversations, any kind of outreach that we could provide, partnering with New York City Health and Hospitals Corporation, with the Department of Health, other community-based organizations, to get accurate information out to the community and to be able to provide a forum for people to ask questions and really to ask, did you get that vaccine, Rhonda? Would you give it to your children? Absolutely. So to serve as a resource for the community.
In addition to working with health, I know that Children's Aid has really got a variety of different programs. I'm pretty familiar with the organization, but for somebody who's not, talk to us about who Children's Aid actually is.
Well, we are a longstanding social services community organization providing resources to the community, and our mission is to help children living in poverty to succeed and thrive. So we really have four domains of work: education, social emotional support, family and health, family and home, and health. I'm representing our healthcare community here at Children's Aid, but we have educational programs, we have charter school, charter middle school, and elementary school located in the Bronx. We have many social services programs. We have after-school programming and summer camps. We have programs that connect families to resources for healthcare. We have our own foster care agency and resources to provide preventive services so that children can stay and families can stay out of the foster care system, and support for those who are in the foster care system.
And so for you, obviously a comprehensive array of services that are actually provided. But when you talk about drilling down into the area of health and seeing health, talk to us about that, because we know that sometimes when it comes to young people, and particularly those that are in foster care and those that are in in need of in the underserved population, sometimes access to services is not always so easy. So talk to us about what it feels like to be able to bridge that gap and the impact that it's having in the lives of your children.
Absolutely. I've really dedicated my professional career to bridging that gap between um, accurate medical, high quality services and providing it to communities in need. Part of the way we do that is we are actually physically located in those communities of need. Our services are in areas that historically may not have had access to those services. We're located in Harlem, we're located in Northern Staten Island, Washington Heights, and the Bronx. Um, we do a lot of community outreach. We engage the community to see what their actual needs are. In addition, peers to help us to provide those services and health information to young people. So the messaging is better received if it's from someone who looks like you, who has your same life experience. It also provides us with the opportunity to mentor young people and show them various career paths in health education, outreach, social services, et cetera. So we really have our boots on the ground in the communities in need, and engage people kind of firsthand in the services that we provide.
And I know you have some health centers that are located in the borough of the Bronx. Why don't you make our viewers a little bit more aware of the health services that are provided?
Sure. So we have a large health center located at 910 East 172nd Street, open to the community. We provide services there for newborns to the age of 22. Services include primary medical care, dental care, behavioral health services, reproductive health care, health education and outreach, food and nutrition programming, and healthcare management. We also operate another community clinic in Harlem and 6 school-based health centers. One of our school-based health centers is in Charles Drew in the Bronx. So we are really entrenched in the community in the Bronx and providing services at those sites. At our Bronx site, we also have services that are specifically geared towards children and adolescents in foster care and their families. And we have a team of clinicians who provide extensive medical services for foster care children who have maybe some advanced medical needs.
Well, Rhonda, you did say it best, that you have the boots on the ground, and thank you for the work that Children's Aid is doing, particularly in the area of healthcare and making sure that our young people are afforded an equal opportunity, not just for vaccination, but for their healthcare needs. Thank you so much for being with us.
Thank you so much for having us.
All righty, Rhonda Braxton, our guest here on Open. Want to let you know, if you want more information, of course, visit the website at children'saidnyc.org. And of course, on social media, you can follow them at Children's Aid NYC. We do have a lot more show coming up, so we encourage you, don't go anywhere. Open continues coming up right after this.